As coronavirus cases surge across the state, a vaccine could be right around the corner. Oklahoma State Health Department officials say it could arrive next week. 2 Works for You's Mason MAURO shows us why the highest risk patients need it now more than ever.
The COVID patients are sicker right now.
Holding out hope a vaccine arrives sooner rather than later. Officials with the Oklahoma State Health Department say the Pfizer vaccine could be here in a week's time.
It's almost like a light at the end of the tunnel for everybody.
The first wave given to the most at risk. Frontline healthcare workers and long-term facility staff and residents. COVID-19 isn't letting up inside of nursing homes.
The symptoms are worse than they were initially.
Numbers reported by the OSDH show COVID deaths in Oklahoma nursing homes account for about 1/3 of coronavirus deaths statewide. ALEXIS BATISTE set up the COVID unit at Franciscan Villa in Broken Arrow. She tells 2 Works for You the numbers will trend worse if a vaccine doesn't arrive in the coming days.
Once COVID gets in a building, it's a bad deal because it's so hard to get rid of.
COVID patients inside nursing homes aren't the only ones at the facilities to receive the vaccine first. Nurses in the units are scheduled to get the shot soon. Potential immunity protection to go along with heavy head-to-toe protective wear.
This, I believe, for them is it's going to be a relief.
A relief from 10 months of continual stress. A relief knowing they can better care for patients and watch them pull through this deadly virus.
Baptiste tells me that she reached out to all the nurses that she worked with to get their opinion on getting the vaccine themselves, and she says they were a bit wary at first just because the nurses are aware that the vaccine has been fast-tracked to get out to the most at-risk people in a pretty timely manner. But she has told me she's assured them, she showed them the research and the lab studies to show that the efficacy is solid. Now, she doesn't expect the vaccine to have an immediate impact because she says the body takes up maybe 2 to 3 weeks to build up antibodies to the virus, and that will be the same case for the coronavirus vaccine. Reporting in Tulsa, Mason MAURO, 2 Works for You.